And we can now cross to the US and speak to William Schaffner. He's an expert in infectious diseases who teaches at Vanderbilt University in Tennessee. Hello, thank you very much indeed for your time. So the US keeps hitting new infections highs. How do you explain this?
I'm afraid it's very easy to explain, Claire. We opened too early, and the populace was not instructed that they had to keep wearing masks, observe social distancing, and not going to large groups. As the lead-in said, many people going to bars, not wearing masks, and this has led to a profusion of transmission of this virus, and in some locations, an increase in hospitalizations. We have a checkerboard program across the country. We do not have a unified national approach to curtailing this virus yet.
I was going to ask you about that because, of course, the US is a huge country and there's a federal system in place. Is that part of the problem? Or if there were more clarity coming from Washington, would the situation not be as it is?
If there were more national clarity, I would have preferred it coming from Atlanta with the CDC, where usually instructions and planning has originated in previous outbreaks of influenza or approach to Ebola and Zika virus. But this has been led largely by political leadership rather than public health leadership. And that's led to a great deal of confusion and disparate activities across the country.
Isn't that why, I mean, you mentioned that people aren't necessarily social distancing and wearing masks, but isn't that because they're also getting mixed messages or they're not sure who they should be listening to?
Absolutely, you're correct. We have had mixed messages in different parts of the country, and even at the national level, there have been conflicting messages. Many of us in infectious diseases have been saying, listen to the doctors at the national level. But there is a lot of confusion, and even the wearing of masks has become politicized. And so the virus doesn't understand a political affiliation, but wearing of masks has become a symbol of which party you have allegiance to in the United States.
Well, Donald Trump has changed his tone on this. He's now saying he's for masks. Is that too little, too late?
Well, we have heard words, but we haven't seen the examples. And others in the national leadership have said, well, you can wear masks when appropriate. We don't need that. Here in my own community, Nashville, as of last Sunday, the mayor has said you must wear a mask and has signed a proclamation indicating that everyone in Nashville, if they go out of their homes, must wear a mask. Everyone in business, everyone just walking the street, unless you're very separate from other people. That has resulted in virtual complete compliance. And that's the sort of leadership that we need at the national level.
You mentioned before, you were saying how people should listen to doctors. Well, Dr. Anthony Fauci, who, of course, has become very well known now, he's often on people's television screens, and he says the US might get to 100,000 new cases a day if the situation doesn't improve. What do you think needs to happen next to avoid that?
Well, first of all, Dr. Fauci is exactly correct. He's been correct all along. What we need is clear national leadership. We need to have someone designated really as the head of a national program. We need to create that. And then Washington needs to get all the governors together to make sure that we are all adhering to this program. We need a national mask wearing consensus. We need social distancing in every state. We need to start closing our group activities, which have opened up too soon. And there I include not only bars, but religious activities. The virus doesn't care whether it's in a bar or in a religious institution. It likes to spread among people who are gathered together. And we need to try to reduce the spread of this virus.
Are there parts of the country, parts of the US that you're particularly concerned about?
Well, as your lead-in said, the West, California, the Southwest, my part of the country in the South, and particularly in Florida. So that's a large proportion of the country that I am most concerned about. But mind you, Claire, this virus is now everywhere. It originally came to the large cities, but it's now spread to smaller cities and little towns. So it's dispersed over virtually the entire geographic area in the United States. So everyone needs to collaborate in reducing the spread of this virus, whether you're in a rural area or you're in a large city.
All right, we'll have to leave it there. Thank you very much indeed for your time and your analysis. William Schaffner joining us there from Nashville, Tennessee. Thank you.